Hi, let's talk about the palpebral fissures and palpebrae, or the eyelids. So the palpebral fissure is the space between the palpebrae, or the eyelid. So here, I'll outline it here. And therefore, it is the space through which the eye can encounter the external world. There are two sides to the palpebral fissure. There is a lateral angle or canthus and a medial angle or canthus. The palpebrae themselves are somewhat complex layer-wise. From superficial to deep, we have the skin of the eyelids, and then the subcutaneous tissue. Then we have some of the palpebral fibers of orbicularis oculi. And then deep to that, those orbicularis oculi fibers, we have the tarsofascial layer of the palpebrae. And then deep to the tarsofascial layer of the palpebrae, we then have the palpebral conjunctiva. And that palpebral conjunctiva is going to be in close contact with the bulbar conjunctiva, which is upon the eye. So let's really focus on this tarsofascial layer here. This is a very underappreciated part of the orbit. So the first element here that I'd like to draw your attention to is the orbital septum. The orbital septum is a very weak membranous layer that's contiguous with the orbital periosteum. So all around the rim of the orbit, the periostea from those bones is contiguous, and it sends this orbital septum. And the septum is weaving its way around elements like the superior and inferior tarsal plates, which are giving structure and support to the palpebrae. They're weaving behind the medial palpebral ligament and the lateral palpebral ligament, which are anchoring the palpebrae at the angles, or the canthi. And this is important because it's going to serve as a frame of reference to differentiate clinically pre-septal orbital cellulitis from post-septal orbital cellulitis. Pre-septal orbital cellulitis can come from a superficial injury, or an infection or a bug bite. Might present like a swollen eye. Many of you have probably experienced that before, or at least have seen it before. Pre-septal orbital cellulitis is outpatient treatment. Post-septal orbital cellulitis is usually the result of movement of infection from another deep space. So, it could be cellulitis from, typically it would be the ethmoidal air cells or the sphenoidal sinus, mostly the ethmoidal air cells, cavernous sinus, etc. Those post-septal cellulitis, they can be very serious and require inpatient therapy and very rigorous IV antibiotics. So when people are discussing the two types of orbital cellulitis, pre-septal and post-septal, they're actually referencing this orbital septum here. And so this tarsofascial layer of the eye is supporting the palpebrae and allowing them to work to protect and to keep the surface of the eye lubricated. Also, embedded within the tarsofascial layer are going to be tarsal glands, and these tarsal glands are going to have pores along the outer margins of the palpebrae, and some of these you can see quite well. If you look at the conjunctiva, the palpebral conjunctiva adjacent to these glands, you can see how it's a little lighter in spaces. So that glandular material isn't as dark as the vasculature that's going to surround it or interleave between those two elements. So we've discussed the orbital fissure and the medial and lateral angles or canthi, as well as the layers of tissue of the palpebrae, skin, subq, orbicularis oculi, palpebral fibers, that tarsofascial layer, and then finally the palpebral conjunctiva, and some of the elements of that tarsofascial layer. Thank you very much for your time.